right, it looks like most of us are in. Good evening. Welcome to tonight's Hawk Talk. We're super happy to have you here, even on this very warm and muggy day in Maryland. Tonight's Hawk Talk is Your Health at St. Mary's. And I am joined by Laurie Scherer, our Director of the Wellness Center, also with Kathy Pusicker, who is helping us in the back end with all of our tech. Just a few things before we get started. If you could mute your cameras and your mic this evening. We are recording the session so that we can post it later if you have any questions and you'd like to refer back to the session. And any questions that you might have, you can put in the chat and we will get to those towards the end of our presentation. So again, if you could mute your cameras and your mics, that would be fantastic. And I'm going to turn it over to Laurie to welcome you and present on the Wellness Center. Thanks, Laurie.
Thank you, Derek, and welcome everybody. I'm getting ready to share my screen because I have a short presentation of a few slides. Hopefully this allows you to write down contact information or anything that you might find helpful during the presentation. First of all, welcome. I am so excited to be able to talk to all the incoming students and your families. And I'm going to give you a really quick overview of Wellness Center services, but at the end, I'll be taking questions. You're also welcome to contact me directly if you have specific questions that you would like to discuss. So this is me, all my contact information. I'm the director of the Wellness Center. And you can always reach me via email. I'm not so easy to get on the phone, but I do keep up with emails. So the Wellness Center is in Ethel Chance Hall, which is located mid-campus near Montgomery Hall, which is our fine arts building. Here you see our website, which has a lot of information that you could check anytime. We're working to update it. Right now it has on the landing page a place where you can click for new student information. So check that out. You'll find that helpful. We have a Wellness Center overall email address. You can use it anytime to get in touch with us and we will get back to you. After hours care on campus, we encourage students to dial 911 in an emergency, and then public safety offers services to students in an emergency or an urgent situation after hours. All right, so the Wellness Center is health, counseling, and sexual assault advocacy. When you contact the Wellness Center, you're going to run into one of our administrative staff. So you'll see Cecily Kalk or Rachel Corrigan. They are the people who answer the phone, make appointments, share information. They're happy to walk you through anything you have questions about or get you to the person that you need to talk to answer your questions. I'm going to start with our health services. Our Assistant Director for Health is Deborah Bello. She's our staff nurse. The health services that we offer on campus are self-help supplies anytime we're open from 8 a.m. to 5 p.m. on weekdays. Students are welcome to come in to get over-the-counter medications, basic first aid supplies, condoms, and some other safer sex things. You can come in and ask us. If you need something, most likely we can help you out or direct you to get them. We have a nurse triage clinic every weekday from 10 a.m. to 12 noon. If students wake up and feel unwell, they simply walk into the Wellness Center, no appointment needed, and you can talk with the nurse who can then direct you to go from there. In the afternoons from 1 to 4 p.m., we have a provider who comes on campus to see students by appointment. And you can call to make an appointment or come see the nurse who will help you get in to see them if necessary. Our on-campus healthcare is contracted through a local medical group, and we have a nurse practitioner or a physician assistant and a medical assistant who see students by appointment to diagnose and treat minor illnesses and injuries. So this is the scope of our services. We have a nurse who provides education and support to students. She's a staff member who's there all the time. And then we do the basic primary care services through our contracted healthcare. We refer to community-based services for specialized care. If you have any questions about specific things that we do or don't do, you're welcome to ask during this presentation or call us up if you would like to talk to us individually. In our community, we have MedStar St. Mary's Hospital. That's the hospital in the county where the college is. We have several urgent care centers we can send students to. We work with St. Mary's County Health Department. They also offer outpatient services on a sliding scale fee. We use the Ridge Volunteer Fire and EMS. They're the ones nearest to campus who usually respond. And we have a pharmacy that delivers medications to campus if students need to get a prescription medication. Don't worry about memorizing any of these. As students need these services, we make sure that we let them know how to access them. Now I'm going to go on to our counseling services, and the Assistant Director for Counseling is Danielle Johnson. We provide traditional therapy type appointments where a student does an intake session and we do traditional brief solution focused counseling. The average students who comes to the Wellness Center for traditional counseling will see a therapist for about 6 appointments, but we do let the therapists use their clinical judgment to decide how long they're going to see a student depending on what's going on. We also offer walk-ins every weekday from 1 to 3 p.m. Students can show up in that time and first come, first serve. They see a clinician who will help them with making a plan of what to do next, whether it's something that needs immediate help or they schedule them for an appointment or get them to other resources on campus. Anytime we're open, we accept walk-ins for urgent appointments. This means that if a student is in class or in their residence or they've just arrived on campus and something's just off, they don't feel well, they feel like they're having a panic attack, please come to the Wellness Center. We have the staff nurse and triage therapists available to see students at any time. And here's our counseling staff, just so you can see their faces. So we have Emily and Maria, Kelly, Danielle, and I also serve as a counselor. So you can see some of us wear 2 hats. We also offer psychiatric medication management visits with a psychiatric nurse practitioner. So the way to get in to see the psychiatric nurse practitioner is to make a counseling appointment. We will then refer you into the psychiatric medication management. Please be aware that if you want to see our psychiatric nurse practitioner, she sometimes has a long wait for appointments, so it's helpful to plan ahead. In fact, if you know that you would like to see her for appointments while you're on campus, you can set up appointments now. We're scheduling for intake starting now. I also want to make sure that you know that we don't see students during breaks. So the nurse practitioner cannot renew prescriptions during our month-long semester break in the winter and the 3 months in the summer. So our scope of service for counseling is basic things that students encounter, usually anxiety, depression, adjustment to college, roommate. There's just a lot that happens as you're attending college and learning new things and living with new people. We're very happy to help you out with any of that. We're comfortable seeing students who have a long-standing history of anxiety or depression. We work with a psychiatric nurse practitioner, and we can also work with your home providers. If we have students who need more intensive counseling than this model that I'm talking about, we encourage you to continue working with your treatment team at home if that's feasible. And right now, after COVID, a lot of practitioners are offering telehealth. So if you can continue with the same counselor or doctor that you've been seeing while you're at college, that's great. Then you don't have to switch to us. We're still there if you need us in an emergency or for a walk-in. But we also can't offer services when students are not on campus. For psychiatric care in the community, we again use MedStar St. Mary's Hospital Emergency Department, where they'll do psychiatric assessments. And we refer to local therapists and psychologists, and we maintain a list of resources if you would like to know who you could contact in the community. And the last part of what we do is sexual assault advocacy, and this is Kelly Muldoon. She is our sexual assault advocate. We have 24-hour response through public safety, where if somebody would like to contact the sexual assault advocate, public safety calls Kelly and she can meet the student. She'll take the student to the hospital or to talk to the Title IX investigators and even to the Sheriff's Department if it's local law enforcement. She can help with a lot of information about what's happening in the cases, how it progresses, she is there to support the survivor who needs the services. So I've given you a real quick overview. One thing I want to remind you about is that we need to have students share their health history through our electronic medical records. I know that's one of the check items on your admissions checklist, so please make sure you do that. Any questions, give us a call. And we also need you to upload your vaccine record or submit an exemption. So now I am happy to take questions.
Please add any questions you might have into the chat and we will answer them. But to get you started, Laura, you mentioned that there are over-the-counter medications available. Is there a charge for that?
Nope, they're free. All of the services at the Wellness Center are covered by student fees. So we provide what we can for students. And so there's no charge to come in and you just fill out a form and say, I want throat lozenges, throat spray or something for upset tummies. We'll give it to you.
So I'll throw this out there to both of us, but if a student needs access to off-campus care, but they don't have a car, how might they go taking care of that?
All right, we work hard to make sure we can bring services to students, but it doesn't always work that way. Sometimes a student needs to get off campus. Depending on the level of urgency, we can do everything from calling an ambulance to transport a student to getting one of our student drivers to drive a student to an appointment. We have some Uber type things and a bus system in the county that we can help you navigate if necessary. I don't know, is there more to add to that, Derek?
I think you got it. What are, for health, what are sort of some of the normal things that students come in when they're concerned about their health?
It seems like every year when we all gather back together and everyone moves in the residence halls and we start going to classes, there's a cold that starts going around. And people will start coming to see us for those upper respiratory infections. Of course, just coming off COVID now, we have that concern when somebody has the symptoms. So we strongly encourage you, come talk to us, let us know what's happening, and let the nurse help you decide the next steps.
Can all medicines, even controlled substances, be sent to campus?
Okay, Ellie, I think you're asking about the delivery service of bringing prescriptions to campus. Okay, if that's what you're talking about, the guy who brings down the delivery service, if he has a controlled substance to deliver to a student, he's going to want you to hand over the hard copy paper prescription, and then he'll give you the medication when you sign for it. So yes, it can be delivered on campus, but that doesn't cover things like mailing. I don't think that many mail order pharmacies will deliver controlled substances, but check with your insurance. We can definitely have the pharmacy we work with bring things to campus.
Other questions? Laura, I know you work with not just health counseling and sexual assault advocacy, but you have an amazing group of students who do educational programming on campus as well. Can you talk about them?
Sure. Oh, and real quick, Julia, we'll help you set up a account with the PJ Bean building to deliver stuff to campus. If you just come in, we have a quick handout we give students and we'll help you sign up to have delivery right there. So come see us when you're on campus or give us a call. Remind me what you asked, Derek?
PhDs and Smarties.
Right. We have the honor of working with two student groups. There are two groups of interns who get paid for the work that they do with the Wellness Center. They receive some extensive training, about a week-long training, and they help students out in several ways. The peer health educators, or PHEs, do programming on campus. You'll see in October, we do our 5K to stomp out stigma. And that's one of our first big events that we get everybody out and support the idea that taking care of your mental health should not be stigmatized. Asking for help should be easy. They do programming in the residence halls, and they also offer peer counseling in the Wellness Center. I talked about the walk-in hours. You get to choose whether you want to see a professional counselor or a peer counselor. Totally up to you. Sometimes it's helpful to talk to a peer, other times you want a professional, but we provide both. Our other group are called the Smarties. They're the Sexual Misconduct Advocacy and Resource Team, and they do a lot of programming on campus, and they offer a 24/7 helpline for any student to call who has a question about sexual misconduct, about something that they've heard or seen or want to talk about. All of our student workers are covered under our confidentiality and can provide confidential care to other students on campus when they're in their role. All right, Vincent asked, does the Wellness Center store injectable medications? We really encourage you to have a way to store it in your living space. So that would include ensuring you have a refrigerator and keeping it there. We're happy to make appointments for the nurse to give you the injections, and she would probably offer to teach you how to do them yourself if it's something you're going to be experiencing often. But we know not everybody wants to do their own injections, so you most certainly can bring the medication to the Wellness Center to receive the injection there.
Just about the refrigerator, students are allowed to have one mini fridge in their room, but if you need a second fridge to store medications or anything else related to your health, you can refer back to our session a few weeks ago with our accessibility services, and they can walk you through being able to have additional refrigerators in your room. Is there a website about the PHE and Peer Health programs for later reference?
Yes, so for students to be part of our Peer Health Educator or SMART student programs, we ask that they be second-year students at St. Mary's, so that that first year you get to really focus on acclimating to college, doing well, understanding how the whole system works. We start accepting applications in the spring, and to access those, you will go to our Career Development Center's website called Hire SMCM, HIRE SMCM, and that's where all student jobs on campus are located.
Other questions? Trying to think of anything else about Wellness Center, but nothing comes to mind right now.
I really want to encourage you to stop by, say hello to us. We're going to have an open house the first week, and just make sure you feel comfortable, because you may never need to come visit us. And I certainly hope that there's never a time you have to come visit us, but to know that we're there, to get to see that we are people who also are part of the campus community and are willing to meet with students. It's a really good resource. And sometimes when you don't know where to go, you can come see us. We're confidential. Nothing's going to happen other than we're going to get you the support you need or get you to where you need to be.
Thank you. I'll give one more shot.
Oh,
Hey.
hi. Well, stop in. We're still set up on campus so that when you're indoors, you need to wear a mask. So come on in. We have masks if you don't have one, but come say hi and just see our space. We're getting ready. Julia asked if there are more restrictions for unvaccinated students. Right now, we're collecting data, and there is a policy that all students, staff, and faculty should be vaccinated or have an exemption. If you're a student who's on campus with an exemption, we're going to ask that you be a little more prudent in wearing a mask, but please also know that there are many students on campus after last year who got used to wearing a mask, who found it to be helpful. Just remember when I talked about that generalized cold we all get in the fall? Maybe we can reduce that and some other things. There will be mask wearing to everyone's comfort level, but other than that, I'm not sure there are restrictions for unvaccinated students. They're just going to be included in us being careful for everyone in the community. Yep, every year we do a flu vaccine clinic. Watch for Inside SMCM, which is where we put all our announcements or flyers around campus.
When is that usually offered?
In the fall, we tried to do it before Halloween, try to get a jump start on the flu season.
Thanks.
Laurie, what resources do you have available for healthy eating and weight management? So we hear the freshman 15.
Mm-hmm. So that would probably utilize a lot of different resources on campus. First, you can talk to our nurse if you have specific questions about how your health and your weight and exercise. We do allow students to come in and weigh themselves, and the nurse is there to talk to you if you want to talk about your weight and your goals. We recommend that you use the athletic and recreation complex. There is so much to do there and so many classes are offered. Stay active. You're also going to walk around campus. So that helps. But our food is really good as well. Bon Appetit is our food service, and they have a nutritionist that works for them who offers sessions to students for free. So if you find that you're having trouble navigating going in every day and having this smorgasbord of food available, the nutritionist would be a good person to talk to.
And the nutritionist and the Bon Appetit management staff also will work with you on any food allergies that you might have as well. So the question is, if you're vaccinated, what are the current restrictions? Also, are we allowed to walk around campus and visit facilities without a scheduled tour? And yes, if you are vaccinated, you are welcome to come to campus. We love that you check in with our admission staff and let them know that you're on campus. They can provide you with maps and tours if you want to. But if you're just on campus and you want to visit a facility, meet with Laurie and start getting things set up, not just Laurie, but anyone there or anyone in our offices, you can definitely do that. We welcome you on campus over the summer as well. We still are masked on campus right now. So if you are inside a facility, you should be wearing a mask, but outdoors you are permitted to take your mask off. I guess to wrap up with everything that you provided, Laurie, if you have any tips or ideas to prepare for coming to campus physically and mentally, what are some things that our first year students can do to get ready?
All right, now from a really pragmatic health standpoint, I would say if you are the kind of person who tends to get headaches and you like to take a certain medication, bring it with you. While we can offer you something, it'll be a generic form or may not be the one that you're used to. So bring anything you take regularly for any kind of health condition, or if you tend to get an upset stomach and like a certain medication, please bring that with you. Any medications you bring to campus, you store in your own room. We don't hold medications for students. It's a big leap from how high school operates around medication. You can have what you need to take care of yourself. As far as the counseling goes, there's some students who show up on campus and know right away that they want to engage in counseling and come see us. Others kind of slide into campus life and don't consider it until they hit something that's a little bit concerning to them. And I want to assure you that about 25% of the students on campus do come to counseling. So we see a large number of students. It's very well normalized on campus to seek help and ask help from your residence assistant in the residence hall, from the Wellness Center, from the accommodations people, student services. And like I said before, don't be concerned of where you start. We'll get you where you need to go. So feel comfortable coming to see us. Also, just so you know, inside our door, we have a very large display of condoms and safer sex things for students. That's another reason to come over. Check that all out. Grab what you would like to take. And also, we have a Keurig coffee maker. You're welcome to come and sit there and have a cup of coffee and hang out if you want a quiet place. And we have a meditation room. If you're into meditation, you can use that. Should you come talk to me if you're concerned about another student's health? Yes. Yeah, Nadia, come over and have some coffee with us. But we're very good at listening to your concerns. Like if your roommate is doing something you're concerned about, but you don't want to exactly report it officially to public safety or to residence life, you can come and talk to us. We'll help you walk through it. If you see a teammate or somebody in your class who's behaving in a way that makes you worried about them, please come talk to us. We are a nice, caring community. We completely honor confidentiality, and I won't go checking up on a student, but I can give you some ways to get that student some help or offer that student some support.
Any other questions? Well, we will stick around for a few minutes just in case you have anything that you want to ask with less people in the room. Lori also provided her contact information, so if you want to reach out if there are more private questions that you would like to be addressed. But we are so happy to have you here again, and thank you for joining us for our weekly Hawk Talk.
Yeah, we look forward to seeing you when you're on campus.